Good afternoon, everyone, and thank you for taking the time to watch and listen today. It's been an eventful week. Citizens of the United States went to the polls to elect a new president, a new Congress, and numerous state governors in what has been a bitter and divisive campaign, particularly on the policy over the handling of coronavirus. The presidential election result is on a knife edge, with the outcome still unknown. America and the world is holding its breath. Closer to home, we continue to watch and wait as the United Kingdom and the EU work together towards finding an agreement on trade deals. Despite continued intensive negotiations, there remains a gap between the UK and the European Union's positions. On the COVID-19 front, this past week saw the United Kingdom exceed 1 million confirmed cases of the virus. The number of deaths occurring per day in the UK remains painfully high, and in the hundreds, with more than 47,000 people in the United Kingdom, over half the population of the Isle of Man having now tragically lost their lives. On Saturday, the UK Prime Minister Boris Johnson announced his intention to implement a second lockdown in England. That this announcement came as hundreds of children around our island were out as normal celebrating Hopchin places the current differences between life in the Isle of Man and life in the UK in stark contrast. It is over 5 months since we have had a positive case of COVID-19 in our community. This shows it is essential as ever that we continue to protect the way we have been able to live our lives in these past few months. A second lockdown for England was approved yesterday by the United Kingdom Parliament. And so this morning at 1 minute past midnight, England once again entered lockdown. It will last until at least Wednesday, the 2nd of December. Wales remains in its firebreak lockdown until this Monday, the 9th of November. On Monday, Scotland introduced a new 5-tier protection system with many areas on the second highest level of protection measures. In Northern Ireland, new restrictions put in place in mid-October remain in force. It is a complex picture, and we can only hope that these new, tighter restrictions will have the desired effect of slowing the spread of the virus. It will come as no surprise then that the island remains on level 4 of our borders framework at this time. I am acutely aware, as are many of my colleagues in the Council of Ministers, how many of you would like to bring members of your family here from the UK, Europe and further afield. But this would introduce risk to our community and threatens to put pressures on our health service. I know that there are those of you who would like us to move to level 3A of our borders framework, but now is not the time to be relaxing our borders. I acknowledge that we cannot live like this forever, and we will not keep our borders closed for any longer than is necessary. It is my sincere hope that we will soon see positive changes and that a possible vaccine and better testing will provide us with the tools to plot the most effective way forward. Now, given the situation in the UK, and particularly with the prospect of lockdown in England on Tuesday in the House of Keys, I stated that unless people have a compelling, pressing and importantly legal reason to travel within the United Kingdom or beyond, then they should not do so. Isle of Man residents who need to travel through the United Kingdom to return home to the island will, of course, be able to do so. As at any other time, if travelling to the UK, Isle of Man residents have an obligation to respect UK laws. This means people need to understand the restrictions in place in the particular area of the UK you visit, and full details are available at gov.uk/coronavirus. Here in the Isle of Man, we have had 5 new cases of COVID-19 since my last update to you on Friday. All 5 cases relate to individuals who have recently travelled to the island, and so, thankfully, all 5 individuals were already self-isolating for the required 14 days. This means we can be reasonably sure that the island continues to be free of the virus and that it is not spreading in our community. These 5 cases include individuals who have recently travelled to the United Kingdom for medical appointments. The pandemic has lasted for many months, and it is likely to continue for many more. It is, of course, essential that those in our community who require specialist care and treatment in the United Kingdom can continue to receive this wherever possible. And so trips to specialist centres, particularly in the northwest of England, will continue where necessary. All patient journeys to the UK are individually assessed and, if necessary, approved by the Department of Health and Social Care before a travel warrant is issued. We provide information and guidance to patients travelling to the United Kingdom for appointments. For example, Isle of Man residents visiting Liverpool and Merseyside for medical reasons are advised to travel directly to and from their appointment. This means no detours, no spending time in crowded areas. They are also advised to wear a face mask at all times, unless eating or drinking, and to practice social distancing as far as possible at all times on their journey. Of the 5 new cases detected in the past week, 2 of these people are now in Nobles Hospital, having been admitted for treatment for unrelated non-COVID conditions. It is a case of these patients being in hospital and having the virus, rather than being in hospital because of the virus. Tested positive for COVID-19 as part of the screening process that everyone admitted to hospital undergoes. The screening system worked precisely as it was intended, and the team at Nobles Hospital have taken the appropriate measures to protect other patients, our care professionals and visitors to the hospital. The safeguards in place include the use of enhanced medical-grade personal protective equipment, and the 2 patients are being cared for in a separate, isolated area where they continue their self-isolation. David, perhaps you could expand on this.
Thank you, Chief Minister. Yeah, it's important to emphasise, as the Chief Minister just has, that both patients that are in hospital were admitted to hospital due to other conditions, not because they've got COVID-19. Our excellent risk assessment processes to identify people who may have COVID picked up the 2 current cases, so worked exactly as expected, and both were isolated and appropriate infection prevention and control procedures put in place immediately. We have effective pathways in place for both planned and emergency admissions to ensure the safety and well-being of patients, public and staff around the hospital. And these include a risk assessment around COVID-19 symptoms, and a travel questionnaire is also undertaken for all planned admissions. For emergency admissions, assessment of risk around COVID is undertaken on presentation to the emergency department. All suspected COVID cases are immediately isolated and tested and screened. Our pre-operative processes include screening for COVID, then isolation until the admission date for planned procedures. Records are kept of all hospital visitors for contact tracing purposes, and there's robust infection prevention and control measures in place which are proactively monitored for efficiency by the infection and prevention control team. People may also notice around the hospital, and it's not a matter for concern, people using more PPE because we've escalated our procedures with having 2 COVID positive people within the hospital who are isolated away on one of the wards in side rooms as per our procedure. The more eagle-eyed among you may have noticed with our stats that, of course, we've got 2 people in hospital, but currently the daily stats are showing 0 for hospital admissions. Now, the reason around that is when we designed the stats, the purpose of that section was to report people in hospital because of COVID. Now, these 2 cases, although they've got COVID-19, that's not their reason for being in hospital. These are patients that are in hospital because of other conditions. But for transparency, I have asked today that our reporting changes so that the stats will actually show the number of COVID positive people in hospital, not just those who are actually in hospital because of COVID-19. This is also, of course, the time of year when the hospital comes under strain from ordinary winter flu and other bugs and other conditions as well that people might present with. So it is important that we keep our robust procedures in place and that we try to limit as much as possible those that may come into the hospital. But the processes are working. We have appropriate infection control in place and they have worked exactly as we planned with these 2 cases. Thank you, Chief Minister.
Well, thank you very much, David, and I'm sure you will all join me and David in sending our very best wishes to these 2 people. The number of active cases today in the Isle of Man is 9, and whilst, as I have said, these are all related already to people self-isolating due to recent travel to the island, the upturn in figures reflects the prevalence of the virus in the United Kingdom. We cannot let our guard down. People must think very carefully about any travel off the island. As I have said, your reason for travel should now be compelling, pressing, and importantly, legal. When returning to the island, you must follow the rules. The safety of our island community hinges on the actions that returning residents and visiting key workers take. Everyone must head directly to their home or accommodation and follow the direction notice they have been issued. No ifs, no buts, no excuses. As I've said before, we are only as strong as the weakest link in our chain. Given the situation in the United Kingdom and in England in particular, it is inevitable that we will continue to see Isle of Man students who are studying at UK universities gradually returning home. Despite the lockdown measures and travel restrictions within the UK, I am pleased to advise that we have received assurances that students will be free to return from the United Kingdom to the Isle of Man. Alex, you have a little bit more to say on this and the wider education picture. Alex.
Thank you, Chief Minister. This week, our school pupils returned from a brief half-term break to resume their studies. In England, the exam regulator, Ofqual, has contacted the Secretary of State for Education, Gavin Williamson, to provide more certainty and resilience for GCSE, AS levels, A levels, BTEC and other examinations next year. The UK government has already announced that exams will be delayed for up to 3 weeks to allow for extra teaching and revision. The curriculum in certain subjects has been modified and assessment arrangements have been clarified. Options are also being explored to make exams less daunting for students whilst ensuring they remain a fair test of knowledge and understanding in each subject. Here, the Education Service will continue to monitor the situation across and work with our teachers and schools to ensure a level playing field for all our students. University College Isle of Man has expanded the range of options available and attracted more students to study academically for degrees and undertake vocational training to gain qualifications and skills. GP trainees can now sit some of their exams here rather than having to travel across, and our university is continuing to develop new courses to meet the needs of our NHS, essential services and commercial sector. This time of year, our students across are usually busy going to lectures and supervision sessions whilst enjoying sports and cultural opportunities and a lively social life. From today in England, although schools, universities and colleges remain open, the restriction on socialising and travel mean that the experience of our young people across will be restricted and curtailed. We are already aware of the stress and emotional cost this is inflicting, and some students have decided to stay at home or perhaps come home early and self-isolate. Government is constantly monitoring the health situation both here and across. We have a robust track and trace system in place, close monitoring of those self-isolating, and rapid on-island testing facilities. We've been in close contact with the Ministry of Justice in the UK to ensure our residents who need to return home can do so, and will support them when they are back to ensure their safety and the continuing safety of our community. Universities in England currently remain open. The new guidance in force today does allow students to return for the Christmas break. It does, however, say that they must not move backwards and forwards between their permanent home and college accommodation during term time. I know that a number of our students have already decided to return home to our island before the end of term and continue their courses remotely. This is a decision for students and their families to make. But as things stand, this would seem the best way for students to return, self-isolate for the full 14 days required, and still be able to enjoy Christmas with their families and friends. Those returning students who need support can access facilities at UCM. They can use the online resources and library and take part in the exciting social life there. Advice and support is available for those wanting to switch courses or consider their options, and experienced staff are available to help students through this very difficult time for all of us. But students are also helping each other. I know of several groups of young people who have hired flats and cottages to return together, self-isolate and support each other, and do the right thing for their families and our community. The Manx Students' Union have set up a special scheme called Operation Fairy Bridge. This Facebook group will help provide the latest government information and advertise quarantine accommodation offers and services to our returning young people. Welfare representatives will be providing support and help guide students in the difficult position of juggling studies, travel and quarantine restrictions. Our young people are our future, and I'm proud of the way they and their families are supporting each other during this testing time. Their safety and the continued safety of our community must be our key priority, and government is ready to support our students, whether they be home or away, to continue with their education, succeed in their goals and achieve their true potential. Thank you.
And thank you very much, Alex. And now to questions from the media. And our first today is Alex Bell from BBC Isle of Man. Good afternoon, Alex. Fast am I.
Good afternoon. So we have had a number of cases this week of patients who have travelled off island to hospital appointments only to come back and then test positive for COVID. I'm just wondering how tight the protections are for patients who are travelling off island. So how are they shielded, especially if they're vulnerable, for example, on the ferry travelling out on taxis to transfers and once they arrive at UK hospitals?
Well, obviously, this has happened in the last few days. We have had a couple of these before, Alex, and I know at the time I asked to make sure that the very best advice was given to all patients travelling, and that we did our utmost to reduce the capacity for infection, for them to get an infection or pass the infection on. They are tested when they go to the hospitals in the UK as well. But David, you might want to give some more detail on that.
Yeah, I'm happy to, Chief Minister. So, Alex, there's a range of testing done by the UK hospitals as well. Some insist that people are tested so many days before they travel to the hospital, and they have to isolate right then up until the day of travel. Some UK hospitals do rapid tests when they actually arrive. So there are differing regimes between the hospitals. In terms of transport, that is why we instruct patient transfers to use PPE when they travel, so masks, gloves, etc., to try and minimise that risk. To be perfectly frank, no form of travel is completely and utterly without risk. And these two cases show that, but we do everything in our power to minimise that risk. And as the Chief Minister said in his main speech, that is another reason why the guidance to patient transfers is they go from the port directly to the hospital and then directly back from the hospital to the port again, so that they don't go out into the wider community, which is where the greatest risk is.
Thank you. And just to touch on the point that you made about students there, how closely are you working with the likes of this Operation Fairy Bridge and other sort of community endeavours? Will you be directly giving them advice and will you be directly coordinating with them?
Well, I think we'll be, when the Council of Ministers is constantly reviewing situations and information that we get from the United Kingdom. And if there's anything that impacts our students, then we will, of course, go on to that site, and I'm sure, Alex, you might want to add something to that.
Certainly, Chief Minister. In terms of some of the groups that have been set up, not just during this period, but also earlier on, government have been working with community groups, with the third sector quite closely. Personally, I'm in touch with the people behind the Manx Students' Union and Manx Universe, who've set up virtual communities to help those either here in isolation or across. And we're giving them any advice and any help that they need to support themselves. Because as I said earlier, one of the things we're seeing is young people, students, supporting each other, providing accommodation for each other, doing the right thing by themselves, but also for our community.
Okay, thanks very much, Alex. Now we move on to Rob Pritchard from 3FM. Good afternoon, Rob. Fast am I.
Good afternoon, Chief Minister. My first question, as we all very well know from the first lockdown in the UK, there was a lot of panic buying going on. There's reports of it happening this time around in the UK as well, going into lockdown, or England going into lockdown again, I should say. Given that being the case, are there any issues that could present in terms of supplies coming to the island, and is this being monitored in some way?
Well, it is being monitored, and I was pleased to hear one of our food retailers on the radio this morning giving an interview saying that, you know, on the whole, they expected everything to be available. Obviously, businesses in the United Kingdom are not being stopped, so companies making loo roll, for example, will continue to provide that product. Obviously, we might see some of the regional brands where we have shops on the island, but they're mainly based in the United Kingdom. If they make a national decision to shut down their business, whether it be a clothes outlet, etc., then that's their decision, and we can't interfere with their decision. But we have been contacting all of those outlets to ensure that they understand the Isle of Man's current situation and to try and avoid anything that might have happened when we went into our lockdown at the beginning of this time.
Thank you very much. My second question is for the Education Minister. Good news to hear that there are assurances that students will be able to return home for Christmas. But a lot of them may be travelling long distances, depending on the universities they've been in. And obviously, given the lockdown situation in England, you could have authorities making the likes of travel checks, for example, to make sure that the journeys are essential. I just wondered if you could provide any sort of advice for those students who have to make those journeys about any documents they should have on them or any particular measures that they should take to make that journey as smooth and as comfortable as possible.
Yeah, well, I think that's a very good question. What we're dealing with now, particularly in England, is a relative lockdown. Essential travel is still allowed. People are still being encouraged to go to work, for instance, if they can't work from home. Manufacturing, construction industries are still online. So I think there will be far more movement. We're not anticipating a restriction in things like the train services that we did see earlier on in the year. What we've been trying to make sure all students are aware of is the procedure for coming back to the island, that they need to apply for a landing card and have completed that before they come back. And certainly I'd encourage students to have a copy of that when they're travelling, just in case they get stopped by the authorities. They can show that they're heading home, they're heading back to the Isle of Man, and they've got official permission to do so, and they're part of a structure to get them back home to our island.
Thank you very much.
Okay, thanks very much, Rob. Now we move on to Paul Moulton from Isle of Man Television. Good afternoon, Paul.
Good afternoon, Chief Minister. I think this question probably goes to the Health and Social Care Minister, really. I just want to find out if we can get some more links, or not, as the case may be, about these two cases that went travelling. Is there any way that you can find out where this source has come from, the COVID that has infected these two people? And are you happy that that has now been plugged?
So we know where the patients have been travelling to, Paul. To be perfectly frank, it's nigh on impossible to actually identify the exact source. But we have gone through, obviously, the procedures that were followed. I must say that in relation to these two patients, as far as we are aware, they followed all advice that was given to them. But unfortunately, at some point, they have picked it up en route.
Were they travelling to the same destination? Let's try that.
I can say they weren't travelling to the same destination. It was two separate destinations, but obviously I can't name the exact destinations.
Are you worried then that this can happen? So presumably under such strict conditions?
Well, we have said all along, Paul, that nothing is foolproof. We've always been quite honest about that there is always a risk. And with patient transfer, there is always a risk. But all of the procedures in place are there, to minimise that risk. The other thing we need to focus on is the fact this is two cases. So I think since the entire outbreak, if memory serves me correct, we've had 4 patient transfers that have become infected with COVID. Now that's 4 out of several hundred journeys, if not 1,000 journeys that we've undertaken since then. So we have to put it in perspective with the number of people travelling for medical conditions. So it's 4 out of several hundred, maybe even up to 1,000 if we go right back to March.
Okay, my second question, therefore, now is they were picked up at the hospital here in the Isle of Man. They were going for more treatment, were they? So they came back. There's no testing, as you know. You say you don't need it here. How else would they been picked up if they hadn't had a hospital appointment?
Yeah, they were asymptomatic, so they weren't showing any symptoms. So they would have done their 14 days isolation.
Thank you very much for that, Paul. And now Simon Richardson of Business 365. Good afternoon, Simon. Faster my.
Good afternoon, gentlemen. My first question really follows on from what's been mentioned before. Christmas is obviously looming closer, and assuming that the UK lockdown does end before the festive season, are you able to give any clarity on who will be allowed to come to the Isle of Man for Christmas? You touched on the situation regarding students, but what of Manx passport holders who are currently living and working in the UK or beyond? Is there any provision possibly going to be made for them?
Well, sadly, Simon, it's just too early to give a definitive answer on that. Obviously, we have an exit strategy. We have a plan where we look at the number of cases that are in the United Kingdom, especially in the northwest, and then decide, is it safe to allow additional people to come to the island, given the infection rate per 100,000 in the United Kingdom. So at this moment in time, I'm afraid, obviously, with an infection rate of over 400 in the northwest, that's not achievable. We can't allow that to happen. Now, obviously, I would love to be able to say, yes, we're going to move to 3A, that the infection rate is low enough. And who knows, maybe this month lockdown in England and the other preventative measures that are being taken in Scotland and Wales will enable the United Kingdom to get down to an acceptable level of risk for us to say, yes, with loved ones who have a Manx passport wanting to come home for Christmas, that's acceptable. Sadly, as much as I would love to say, yes, we can guarantee this is going to happen, I can't, because we just don't know where the United Kingdom will be in a month's time. But we are obviously reviewing this all the time. We'll be monitoring the hopeful significant reduction in cases in the UK, and the minute that we think we can give an update on this topic, then we will, Simon. But just at this moment in time, it would be a pure guess, and I'm not prepared to do that. I think people need definitive details, and I can't say that on the 8th of December, for example, we'll definitely allow people on. We just do not know until we see what the infection rate is in the United Kingdom. So, sorry, I can't give you a clear answer on that, Simon. Your next question.
My second is for the Education Minister, please, if possible.
Certainly.
Good afternoon, Dr. Allinson.
Good afternoon.
Now, my question is really, has there been a detected rise in the number of Isle of Man students who've decided to maybe not continue with their degrees in the UK and move on and do something else?
We've been monitoring the situation in terms of those students who have either tried to postpone going across in the first place or in fact abandoned their studies and gone for a different route, for instance, employment. Actually, the vast majority of Isle of Man students have taken up the offer of going across to university or studying on the island at University College Isle of Man, which has expanded their number of courses. There's always a little bit of a dropout rate after the first term at any time of students, and we're very aware with the extra stresses and emotional burden of Isle of Man students going across, that might be worse this time, which is why I think the support that we can offer here, either through the health service if people need counselling, through the COOTH website is very useful, through UCM in terms of the advice and support they can give to people who perhaps might need to want to switch studies or switch to doing an on-island provision if possible rather than go back, but also in terms of the support other students can give to them through the virtual networks when they come back here is really important. But in answer to your question, no, the vast majority of students have taken up that offer. I think they voted with their feet in confidence that they want to have a decent future, that they don't want to put everything on hold for whatever period that may be. But we need to monitor that quite carefully, particularly as students start returning, to make sure we can give them the support they need to carry on with their education.
Thank you.
Thank you very much, Simon. And now we move on to Tim Glover at Manx Radio. Good afternoon, Tim. Faster my.
Faster my. Wards 1 and 2 were the COVID wards when we had our previous lockdown. And I know from recently going to the hospital to visit somebody, they were having a test before as when they got into hospital, and they were put in a single room on Ward 1. Where exactly are the two cases that we've got now being housed? And also, you mentioned enhanced PPE. You'll see that at the hospital at the moment. Ramsey Cottage Hospital, we're hearing, is resorting to the regime it had as well during the 3 months lockdown, where people wait outside. Can you confirm what's happening at Ramsey Cottage Hospital?
Right, well, first and foremost, I believe it's Ward 1 at Nobles Hospital in isolation rooms. So it's not in the ward itself, it's in separate rooms. Each patient has their own private room where we're able to isolate them, and all the full PPE is used by our people that are looking after them and helping them get better. David, if you'd like to give a more detailed answer, please.
Yeah, certainly, Tim. So the Chief Minister's quite correct. It is Ward 1. Ward 1 has 5 side rooms that are separated off from the main ward itself. So those rooms can be used for isolation of anyone coming in who needs treatment who is COVID positive. So 2 of those are now occupied. As such, the main ward can continue to operate as normal. There's infection control policies in place. There is no risk to anyone else on that ward. The issue would come if we filled up the 5 side rooms, then obviously we would need to take Ward 1 back to where it was during the pandemic period of it being a pure COVID ward, if it went beyond that. In relation to Ramsey Cottage Hospital, they have stepped back up their procedures because Ramsey, of course, is being used quite a lot as a step-down facility. So it's people coming out of hospital into there, and by the very nature, it's there for the more elderly patients that are catered for. So again, it's no matter for concern for people. Nothing has happened up at Ramsey that has any concern. It is simply the fact they have stepped their processes up, as we rightly should, with the infection rate we have in the UK and the fact we do already have 2 cases being seen to in Nobles for other conditions.
And long COVID sufferers have been contacting Manx Radio, calling for government advice on how to manage symptoms and for support. We've asked on their behalf, but we've heard nothing so far. Are they being ignored a little bit?
Well, if I may, Chief Minister,
Yes,
yeah.
David.
If I can take this one. No, they're not, Tim. The simple fact is the guidance at the moment, and I've spoken to several other long COVID sufferers. I think the Chief Minister himself mentioned at a press briefing either last week or the week before that he himself has had certain things around his taste and smell that haven't returned.
Which you classed as minor.
Yeah. Well, yes, I did. I'm sure the Chief Minister will beat me up for that later. But the simple fact is that the evidence is still building around this, around what network of support needs to be in. NHS England has been doing a lot of work in this, and we are following the guidance that is there. But I've got to be frank, the guidance at the moment is a bit bitty, because different people are experiencing different things. So don't want to get the eye of the Chief Minister. You've got everything from the minor symptoms of taste not returning right the way up to people with serious lung damage. And I think we've spoken before about the rather pleasant thing of sticky blood syndrome. And so each of those is going to need a different management routine. So it's not a case of we can treat everyone the same and put them on the same pathway. The simple fact is there is going to be so many different things seen with this long COVID that every patient's going to have to be treated as unique and dealt with on an individual basis. I don't think there's ever going to be one set of guidance that will be able to cover it.
Thank you very much, Tim. Now we move on to Josh Stokes from ITV Granada. Good afternoon, Josh. Fast am I.
Good afternoon, Chief Minister. My first question, a recurring piece of information that we as press are receiving when a new case of coronavirus emerges is that other people of the household are now also isolating. So is the government now advising that everyone in the household now must isolate, or are people voluntarily making that decision to isolate if someone in their household tests positive?
If someone tests positive in the household, then the entire household must isolate. I don't know, David, if you want to expand on that.
Yeah, that has always been the case, Josh. That hasn't changed. If someone physically tests positive, then the entire household must isolate.
Okay, thank you. And my second question is to the Education Minister, please.
Hello there, Josh.
Hello, Dr. Anderson. I've been in touch with many students over the past few days, many really struggling to know where to turn for advice and what to do. Yeah. Do you accept that the government has been slow to move on this issue of university students coming back, as the self-isolation policy hasn't changed for months? Couldn't plans have been put in place sooner, as it looks now almost that the newly formed Students' Union has had to tackle the problem themselves?
No, I think what the department and the Education Service have been trying to do is support those students to go across or stay on island and study at UCM. I'm quite happy for students to organise services around themselves, but the Department of Education, Sport and Culture have been in regular conversation with students, those who may be coming into financial difficulties because normally they work when they're in the United Kingdom and that work hasn't materialised or they haven't been able to get the jobs that they normally do. What we've seen since last Saturday with the announcement by the British Prime Minister of what's effectively a real restriction on travel is people evaluating their future, whether they want to come back or not. The department went out and surveyed over 900 students last week to find out when they wanted to come home, what their plans were. And around about 92% of them had said that they want to come back for Christmas. 8% of them said that they were going to stay in the United Kingdom or the island of Ireland. And so we're working with them to find out when they wanted to come back and then plan around that to facilitate it. What we now have, obviously, is a very changing situation in the United Kingdom. Whilst universities have stayed open, some of them have switched just to remote learning rather than face-to-face, whereas others are still doing supervisions and lectures, but with social distancing. So it's not a one-size-fits-all for students, and what we're trying to do is work with all of them, but to say if they are running into problems either financially or need advice, we will provide that either through the department, through the education service, or if they're back here, through UCM.
Okay, thank you. Just as a final point on that, there are some students whose semesters finish around the 18th of December. Yep. Can you just clarify that your advice to those people is, unfortunately, if they do come back after that, they will be confined basically to their room for Christmas Day?
And that's very much the case. And I personally know of some, for instance, medical students who are on placement and have to stay until the end of December. What we've done is look at the various closing times of universities, and it goes from anywhere from the 4th of December right up to the 17th or 18th, which obviously puts students at a difficult situation if they want to come home and self-isolate and have Christmas with their families. I think what we'll see is quite a few universities recognising this issue, both for UK-based students but also Isle of Man students, and perhaps changing their schedules to allow people to self-isolate before they go back into the family home. But we will keep a close eye on this situation and obviously support those students who may be coming into problems, who can't perhaps isolate at home because of either there's no space or because there might be family members there with pre-existing conditions.
Okay, thank you very much, Josh. And now, last but not least, Sam Turton from Isle of Man Newspapers. Good afternoon, Sam. Pastor Mai.
Pastor Mai, Chief Minister. I just want to start with Dr. Anderson. Sorry, just a couple of questions on university students. First of all, has the department had an indication from students where they feel they're not getting value for their course? And after all, this is taxpayers' money, and will the department be looking at whether or not it will be paying the entirety of fees or indeed trying to claim some back?
Yeah, I mean, we had this situation earlier on in the year when universities closed and people came home early. From the university's perspective, they are still providing facilities for those students who are there. Universities are staying open. Some may have switched all their teaching to online, but they're still providing that teaching. And so it's very hard for us to argue with the plethora of universities our students go to that they should have special dispensation. I know this is certainly something that's been taken up with the British government in terms of working with universities, and so those students who may be disadvantaged through tuition fees, whether they can apply for a refund of those. But again, that has to be something that's UK-wide rather than just for Isle of Man students. There's also the separate issue of those students who are across who are paying for accommodation that they may not be using because either they've come home early or they've decided not to go over there. And again, we've worked with a number of students who've been in this position, and I've approached universities on their behalf. The essence is that each case is separate. Sometimes they've entered into legally binding contracts with private landlords or perhaps with those universities themselves. And so we have been trying to give advice to students, but if they have signed a contract, it's really difficult to then influence that landlord or that accommodation provider to give them a discount. But we will be monitoring the situation and helping as much as possible.
I think before you move on to that one, Sam, it's also worth noting that there are a group of parents who have to pay for their children's education, and when we have any information on what's happening with, obviously the Department of Education, Sport and Culture is a big customer, but if they get any update that there might be a reduction, etc., then we will be advising those parents that are paying for their young people's education. Your next question, Sam.
And just secondly, I don't know if this information has been able to be shared at all, or whether or not, do we as a government have an idea of how many students may have contracted COVID while they've been in the UK, and have they been under any obligation to inform the Manx government of this either earlier in the term or as we approach the Christmas break and as they return to the island?
If I can answer
Alex,
that,
if you want to take that,
Chief
yeah.
Minister, certainly. Unfortunately, we don't have that information. Well, obviously, it's a very much a confidential thing. We know that quite a few Manx students who are at university may have been tested and may have been positive and then had to self-isolate. Other Manx students may have had to self-isolate within that household or within that hall of residence who haven't been tested, have been asymptomatic, or who may have had the infection themselves. But I can't give you those individual numbers because we don't ask those sort of personal details. What we can say, though, is unfortunately, even though students have been proved to have the infection and be positive, when they come back to the island, they will still be expected to do a 14-day quarantine, just to be absolutely certain that they, their families, and our community is safe. So I'm sorry for those students who may have already had to quarantine when they're across, but when they come back to the Isle of Man, they will still need to quarantine here.
Thank you very much for all of your questions today. Now, if you are listening from off island and are due to return in the coming days and weeks, remember our COVID-free status depends on you and your actions. Please act responsibly and bear in mind that these measures are not just in place to protect you, but to protect everyone in our community, including your loved ones and particularly those who are most vulnerable to this virus. Those of you out this evening on bonfire night, I hope the weather holds. Enjoy and be safe. Thank you again for watching and listening.